This recorded review will be going over MedSurg 2 Exam 2 Study Outline. On this exam, there is one Select All That Apply question, and there are about 10 fundamentals questions. Take a look at box 19.2 on page 350, Introduction to Pharmacology textbook. Look at post-op care after cataract surgery on page 602. Know that patients should be resting in the semi-Fowler's position postoperatively after cataract surgery. Understand general care after eye surgery. Check out the blue patient teaching box on page 602. Numerous questions from this box. Also take a look at the purple home care box after retinal surgery, page 611. Take a look at nursing interventions for visually impaired patients on page 596 to 597. If a patient has lost the corneal reflex, you can place a patch over their affected eye. Also take a look at general postoperative care after eye surgery on page 614. Again, numerous questions regarding post-op care after eye surgery. Take a look at signs and symptoms of cataracts on page 601. What part of the eye do cataracts affect? You can see this on page 601. Know the signs and symptoms of an acoustic neuroma, page 635. Know the signs and symptoms of open-angle glaucoma, page 604. Understand that valerian root can have interactions with CNS depressant drugs. Know the treatment and nursing management of labyrinthitis on page 634. Know the nursing management for retinal detachment, page 610. Understand that patients should restrict their head movement preoperatively for retinal detachment. What is a common screening technique used for glaucoma? Check out page 605. Patient teaching, look at the blue box on page 608. Understand that echinacea can decrease the effects of immunosuppressant medications. After the age of 75, what percentage of older adults will suffer from some degree of hearing loss? You can see this on page 619. Understand basic eye care. How do we care for our eyes to prevent any of these disorders from happening? You can see this on page 588. How can atherosclerosis play a role in hearing loss? See this on page 620. A choked disc on page 587. This indicates increased intracranial pressure. How often should we be discarding our eye makeup? See this on page 589. How does cerumen affect hearing as we age? See this on page 619. According to the NIDCD, what percentage of adults aged 20 to 69 are showing signs of noise-induced hearing loss? See this on page 619. What are the signs and symptoms of otitis media? See this on page 633. How would the nurse perform a visual fields test? You can read about this on table 25.2, page 591. Know the signs and symptoms of otitis media, page 633. How would a nurse perform a visual fields test? Oh, I did that one already. That's table 25.2, page 591. Describe a chalazion. You can see this on table 25.4, page 595. How would you care for patients with dizziness and vertigo? Check out page 629. Also understand which part of the ear is affected for patients suffering from dizziness and vertigo related to the ear. Above what decibel level is considered hazardous for hearing loss? See this on table 26.1, page 621. How would you perform a Romberg test? See this on page 623. What is the purpose of a visual acuity test? See this on table 25.2, page 591. What classes of drugs are commonly used to treat glaucoma? Just focus on the classes of drugs. Table 25.5, page 606.